Hey everyone, this is Andrew J. Polk with News Radio 690 KTSM, host of Talk El Paso, which airs live every Saturday morning. Wanted to bring a little bit more attention to an interview that we did this week that I thought was very interesting. We've all heard a lot about what happens to patients. They're trying to get through the COVID-19 coronavirus pandemic that we're going through, the process it takes, how difficult it can be. But we're not hearing so much about what happens after they get released. I'm sure we've seen the videos of people being wheeled out of the hospital with everyone clapping, and that's great, but that's not the end of the road for the people who are in that recovery mode. There's a lot more that is going on, so I got a chance to talk with an expert on this, a physical therapist who has a little bit more insight on the road ahead for those people and some very important things to really show us how devastating this disease can be. So here, enjoy that interview right now. Joining me now, we are talking with Dr. Parul Haribhai, Doctor of Physical Therapy. Thank you very much for joining us today.
Thank you for having me on the show. Excited to be here.
Yeah, and I'm excited to talk with you as well because there's something that hasn't been discussed that much that I think people will be very interested to know about, and that is what the physical therapy needs are of people who are recovering from the COVID-19 coronavirus. We've heard a lot about, what's going on in the hospital, some first-person accounts of what they're going through, but the road to recovery doesn't end once they're even released from the hospital. There's a lot more that they often need to go through, right?
A lot, right. So just in general, anyone recovering from any kind of hospitalization stay usually requires a lot of rehabilitation afterwards in order to, first of all, just function around the house, then to be able to do their own chores, or we call them activities of daily living, like going into the yard or a little bit of driving in the community. And then after that, if they're working, then integrating them back into their work life. So it can just normally take a few months. Post-COVID, we're still researching and doing more, but we're finding that due to their respiratory function that has been so compromised, they are going to require a lot more intense therapy afterwards to regain that lung function and to be able to function again.
So what kind of therapy does that end up looking like for when they're ready to begin that?
So right after a hospital stay, they would most likely go to another kind of hospital, which is called a rehab hospital, where they're not as sick and definitely need to be off the ventilator if they're on one. And that stay in a rehab hospital can be anywhere from 2 to 4 weeks, depending on how independent they get. And then after that, some of them, if they're still pretty debilitated, would need home health physical therapy, where a therapist can come to the patient's house and offer therapy depending on the patient's needs. It could be 3 times a week or 4 times a week. And if they pass that, meaning that they have achieved as much as they can in the house, then they can be referred for outpatient physical therapy, and where there's more equipment for the patient to use, more machines, more weights, so that type of stuff.
So really just on kind of building them back up to where they may have been. I know I've seen one stark and striking photo of a guy who was pretty built, had the pecs, had the six-pack, and then coming out of the hospital after he had come down with the coronavirus, looked like a shadow of himself practically, like the bulk was gone. So it's all about kind of getting them back to at least their base functionality, or in that guy's case, maybe trying to get him back to where he was, which will take some time.
Yes, and I'm glad you brought that up about he was a shadow of himself. So some of the latest research coming out on COVID is showing that due to the immune response in some people, where the body is just attacking this virus and then attacking the body as well, due to that, there has been a significant loss of skeletal muscle. So the muscle fibers in our whole body are being attacked, and some patients are losing massive amounts, up to 40% of that. So that is huge, and all that would take many months to recover back.
Yeah, so that's definitely a road that some people are going to have to be considering as we have more people recovering in this community from it, either from what symptoms they had or after being released from the hospital. That may be something they have to consider. But as a physical therapy clinic that you run, what are some of the steps that you're taking kind of in response to some of the safety issues for clients of all types that are coming in and needing physical therapy? What's some of the things that you are doing to make sure they stay safe?
Yes, so we're following CDC guidelines to the T. So all patients are required to have a mask on. All the therapists and my staff have a mask on. We have closed our waiting room off completely, so patients wait in their car until it's their appointment time. They call in to let us know that they have arrived, and then one of my staff members will go bring them in. Once they're in the clinic, any surface they touch is wiped down immediately with either alcohol-based wipes or bleach and water, again, which has been determined by the CDC to be appropriate. We change linens after every single patient, and we're also seeing just one patient per therapist per hour so that we can maintain social distancing and the 6 feet between patients.
Very important.
Yes.
So if people are looking for physical therapy, looking for, because life has still continued and people, they're particularly in that process already before any of this stuff kind of kept coming down, what kind of services do you offer and can have people come in and do?
So we offer a full outpatient physical therapy, which would include any kind of therapy that they would need for things like back pain, neck pain, any kind of limb injuries they've had, ankle sprains, shoulder, hand injuries, any kind of non-essential surgery they've been through that have now started back up again, any knee surgeries, hip surgeries, any type of those type of injuries we can see. But what's important right now, what we are seeing a bit more of, is that people who are working from home are starting to develop a lot of back and neck pain because they're sitting in chairs they're not used to. They're using their dining room chairs or just on the couch, and after a while their posture is not looking good at all, and all this is leading to a lot of back and neck pain. So in particular right now, if there's anybody out there who's noticed that or feels that they're, experiencing that, we would definitely be a good place for them to come to.
Yeah, I know I'm experiencing some of that as I've been moving in and out of the house, sometimes in our studio, sometimes not. So definitely good advice there. So if people want to find out more about that or see if they can get those kind of services, how can they best reach out to you?
They can call our office at 915-444-5200. In the state of Texas, anyone can call and make an appointment. They do not need a referral to come in and get evaluated and be treated for up to 10 business days. And so once we verify their insurance, if the insurance doesn't require a referral, they can just make the appointment and come in. After 2 weeks, we do need a referral from a medical doctor or nurse practitioner in order to continue therapy after that.
So very important notes there. You can go straight to the therapy, and again, they can call you all at 915-444-5200 or visit your website, p3ptpro.com. My guest right now has been Dr. Parul Haribhai, Doctor of Physical Therapy. Thank you very much for talking to us about all these very important issues here today.
Thank you for having me, and stay safe out there.
So again, I thought that was a very interesting interview on a topic we're just not hearing that much about. So thanks to Dr. Haribhai for taking the time to speak with us about that. And just as a quick important reminder, Talk El Paso will be having its special daily series this June 3rd through June 5th, Wednesday through Friday. So be sure to tune in and help prove that El Paso can support live local talk radio. It's time, and I think we need it. We'll be having some special guests announced soon, so stay tuned for that. Otherwise, thank you for tuning in for Talk El Paso. We'll keep bringing you all this more from the moment every Saturday morning, 9 to 10 a.m. right here on News Radio 690 KTSM. Thank you for joining me. I'm your host, Andrew J. Polk.